See, ICSI is a process by which we are injecting the sperm into the egg. So if the sperm and the egg are both mature and healthy, then fertilization is bound to happen. So we would say that the fertilization rate is almost 100% where ICSI has been used. This is a difficult question to answer. We have to understand that in natural method, what is happening is thousands and thousands of sperms are traveling up the female reproductive tract and then coming in contact with the female egg. So there is bound to be some sort of a selection that's happening amongst these sperms, and hopefully the best amongst the lot has been selected by the oocyte or the egg to form an embryo. ICSI essentially has been offered to couples who are not getting a pregnancy primarily because of male factor infertility, that is, when the sperm defect is very high. Here what we are doing is we are trying to identify a healthy looking sperm and then injecting into the egg to hopefully get a healthy pregnancy. But sometimes looks do not always give you the full picture. So even if the sperm is looking healthy, there is no doubt that there is a higher chance of miscarriage or abnormality in the child in process of ICSI, because essentially we are dealing with sperms which are more damaged than a normal population. ICSI is now the standard option for severe male factor infertility. In IVF or in ART procedures, we can get a pregnancy even if we have 40-50,000 sperms. But for patients who have even less than that, ICSI is required, because technically one sperm injected into one healthy egg can give us a pregnancy. But we need to remember that sometimes, or in rather most cases, ICSI has been performed where the sperm count and quality is very severely compromised. So ICSI on one hand is giving a promise of child to people who were previously considered infertile, on the other hand may have increased the risk of having miscarriages or congenitally deformed children in some other couples. Nowadays a better technique has been promoted to possibly bypass the side effects of ICSI. That technique is known as IMSI or IMSI.